Good afternoon and evening, everyone. Thanks for joining us on Solutions for Inflammation and Pain. My name's Heather Schofield, and I'm the Medical Education Director here with Biomed, and I'm super excited to be able to talk about this topic tonight with you.
And I am Angela Reimche, so I'm professional advisor, and also I handle the education as well as medical support specialists and consults building with our practitioners, and I tag team with my beautiful, lovely colleague, Heather, over here.
Okay, so for those of you that have been on tag team webinars with us before, then you know that you're in for lots of really great information. So with inflammation, one of the reasons we wanted to talk about this is, number one, it's not a topic that, as far as webinars or workshops, that we've ever actually dedicated a set webinar for, and we do have a lot of variety of options to be able to help with inflammation and pain. And then in addition to that, Angela and I both want to challenge you in thinking about root cause, which we'll come to a little bit later in the presentation. And because inflammation truly, it's not just about addressing symptoms, it's really getting to the root cause. And then the root cause you're thinking you're getting to, is that really truly the root cause that you could be getting to, or is there something further and underlying there? So why do I care about inflammation? And as practitioners, we all know that we actually care a lot about inflammation because inflammation plays a huge role in most chronic health conditions that we see today with our patients and with our clients. Chronic inflammation is definitely touted as a silent killer. And so there is the initial inflammation from an acute inflammatory response. And in that, these fellows here, as far as the pillars with inflammation, we see things like heat, redness, and swelling and pain, and also potentially loss of function. In acute situations, this is all actually serves a very important purpose because what it does is it allows the body to actually heal. So in an acute inflammatory response, we get some sort of injury, some sort of wound. It could be also then after you have the initial wound, you have an infection from a bacteria or some sort of microorganism, and then you end up getting the cells in the area secreting cytokines. And then that and some of the other chemicals that are secreted promote vasodilation and vascular permeability. So that means that fluid and also white blood cells and other immune cells can get to the site and be able to start dealing with any microorganisms. You also get inflammation, and you get more blood to that area, so that's where you get the heat and the swelling, and you can get the pain with it as well. Once the body does what it needs to do, then you're going to start to get a healing process that happens. So as far as acute inflammation, this is a very natural and normal process. It's really important to allow that inflammation response to continue on, and so that the body is able to naturally heal on its own. However, inflammation starts to become a problem once it becomes chronic.
And once we get that chronic picture, that really is an indication. And most practitioners don't actually think about inflammation and that break in the tissues. It's actually important to allow inflammation to happen because that means you're getting more circulation. So, and you want circulation there because that really starts that repairing and that rapid repairing phase and process. And that's important because what it allows the actual cell membranes to start repairing. So they're the ones that are actually going to be doing most of the work. And so that's why things like vitamin E is important because they help the cell membrane repair, which I'll go into in a lot more details.
So tonight then, what we're truly focusing on is not so much the acute inflammation or that acute inflammatory response, but more about that chronicity and the chronic inflammation, and then it even potentially moving into autoimmunity. However, with that said, Angela and I do have some tools and techniques that you can have in your dispensary to be able to help patients heal well and nicely through a chronic inflammatory process or some sort of acute injury. There's a lot of biochemical markers for inflammation, and you can see that it's very, very complex. Some of these things like C-reactive protein and fibrinogen are things that we actually will be able to touch on because we have some specific products that actually address those types of things. So we'll share that information in a little bit. And the next thing that's really important to know or understand, if you haven't done a lot of training in homotoxicology or biological medicine, this chart is actually a really important chart to at least have some understanding of. And so it's Dr. Reckeweg's 6-phase chart or 6-phase table of homotoxicology. And the 3 columns on the left are all in the body, kind of how it's processing and how things are moving forward. Once you hit the middle or this biological divide, then the phases start to move into more chronic degenerative picture. And so the whole idea, at least when you're working with homotoxicology, is you're determining kind of where people are within their symptoms, and then you're helping to reverse them back through detoxification and other types of biological medicine treatments to get them back into the more humoral and matrix phases and into stages that they can heal. The second column on the left is the inflammation phase. And so this is where after we have the excretion and the body is starting to become more taxed or more stressed and the regulatory responses aren't working as smoothly, inflammation can start. And it really does show that inflammation truly is at the root of every chronic condition in every system within the entire body. Just as an example, within the lymph system, when you're in that excretory phase, you have inflammation of the lymph, and then you start to move into inflamed tonsils and more inflammation within the lymphatic system. And then you get lymph node swelling, and then you move across the biological divide, and then you start to get insufficiency overall of the entire lymph system, which moves to fibrosis, and then can eventually move into lymphoma. So that's that progress of moving more towards that chronic degenerative disease. So again, just to reiterate, the inflammatory stage, while it's a healthy process in acute inflammation, once it starts to hit and the body's not able to self-regulate and get back into regular balance, then you're going to be able to see that chronic conditions can start to build off of that, with inflammation truly being kind of at the root of all of those types of things. Mind you, root cause below that inflammation is another story altogether. Okay. So then one other interesting thing that you may or may not have heard of is this idea of inflammation. And so this is about inflammation and aging and it being kind of this process that's happening. And again, because we just talked about the homotoxicology chart by Dr. Reckeweg, with inflammation as being an underlying cause with all kinds of chronicity sitting on top of it, then naturally, as we age, we do tend to end up with chronic degenerative or types of chronic conditions and diseases. And so in that way then, this term actually makes sense because if we have inflammation as a chronic low-grade situation that happens as we age, then of course inflammation becomes this risk factor for morbidity and mortality in the elderly. And again, showing that there is inflammation kind of at the root of all conditions that we're dealing with. And so once again, Angela and I want to ask you the question, does this have to be part of the natural aging process? Not necessarily. If we can take care of inflammation, then we can allow ourselves and our patients to have a much healthier aging process and not necessarily have to be going down this route.
And then when we think about, like Heather said, with the aging and that degenerative sequence that happens, it's a progression. It's important to understand that while aging is unavoidable, however, we can actually slow down the damage that's done to the body, to the muscles, to the tissues, to the ligaments. And as I stated earlier, we need to look at the cell membrane. So as inflammation becomes chronic, you really get to see the effects on the cell membrane. So And you see the elderly that have this almost fragility to them. And so a big component of when you look at the brain picture and you look at oxidative stress, well, oxidative stress actually eats into cell membrane. So as the elderly age, you have a higher load and a higher grade of oxidative stress due to just all the years of chronic inflammation. And at a deeper picture, when you look much deeper and further, you look at the cell membrane. That's actually what's degrading. It's the cell membrane that's being damaged, and over time, that permeability expedites that oxidative stress, which then you see that frailty that a lot of elderly end up, becoming, and you have that and you can actually see their mortality. So again, as Heather stated, we're asking you, does it actually have to be this way? We can actually combat that frailty by making sure that we keep inflammation down and we reduce oxidative stress, and we make sure that the cell membrane is always intact and repaired. Right. So we got this chart from Dr. Docker's site, and it was important for us to include this because he really illustrates the different chronic conditions and really how inflammation affects the entire body. And Dr. Jocker says that inflammation is at the root of practically all known chronic health conditions. And this is really important to note because if you look at different organs in the body, one of their common underlying component is the mucous membrane. That connects everything. So once the mucous membrane is inflamed, you're going to start seeing pictures and markers in all these other parts of the body, whether it's the thyroid or the kidneys or the muscular system or the cardiovascular. The mucous membrane runs through everything, so that's going to be a first line of inflammation, and if you will, holes that inflammation create. And where, from an example, I'm going slightly off topic, but I'm going to bring it back around. Like when you think about SIBO from a very practical component, is that that leak into the small intestine. But again, it's inflammation, and it's that hole in the intestinal wall. Again, that's inflammation, and that's mucous membrane. So I'm just bringing it back around. So again, it's important to think of inflammation in all chronic situations and conditions that your patients and your clients present. Look at inflammation first and foremost. Take that into a bigger picture. All right. So now, as we stated, we want you to think about the root cause. And not only that, we want you to think about the root cause differently. Really think about the true root cause of pain and inflammation. While on the top, think of it as kind of a pyramid, if you will. You have the picture that's presented that acutely is those symptoms and the actual pain picture. And then from a deeper layer, then you see inflammation. So we want to take it even deeper, looking at biofilm and microbial pathogenic forms of them, and then acid-base imbalance, because, again, at the root of it is the terrain, is the environment of the body. If they're congested, if they're acidic, you can guarantee that there's going to be inflammatory issues happening there. And then we also want to look at the autonomic system, the stress, how the body is able to handle stress, how the body is able to metabolize these, extra neurotransmitters that are being emitted, these hormones that are being secreted. And then at the very, very true root is the emotions. So we want to address and look at the emotional picture, because while you can address all these other symptoms, all these layers, and you'll find 6, 7, 8, 10 months later, that patient will come back and they're still presenting similar picture, and you're wondering, okay, we've handled each of these levels, but you also need to make sure that you address the emotional picture. That's the true underlying root cause of disease. All right, so now we're going to shift gears. As Heather said earlier, this is a workshop, so we really want to give you guys protocols and clinical pros and case studies that we've been privileged enough to acquire from your colleagues. So first, we wanted to take a look at symptoms and pain. So remember that pyramid, the very top of it. So reduce symptoms and pain. So with this, we're talking more acutely. So we're talking more of the acute pain, acute inflammation, that onset of that acute picture, and then work deeper. So this protocol is one that we've had quite a few practitioners that have utilized this and have had really great results, and so that's why we wanted to include that and address that. So curcumin boswellia, for that acute onset pain, it's really important because the turmeric and the boswellia and lecithin, and specifically myriad casprin, that phytosome technology, it really allows to drive the curcumin and the boswellia into the cells. And that phospholipid binding really allows the body to utilize it, because with phospholipids, again, you're going to be getting right into that cell membrane. That's what you want to be repairing. So acutely, injury, get your patients on curcumin boswellia right away to start bringing that. So when you think of acute injury in terms of tears and ligaments, that's where Ligaflex comes into play. And again, get that in right away. 2 capsules 4 times a day with food, and you be aggressive with this one because it works really fast and really well. And it's collagen, enzytol, glucosamine, MSM, horsetail. And so all of these combinations really, really help to repair. So the collagen is going to help repair the actual collagen fibers in the ligaments. And the glucosamine and MSM is really going to help to bring out that inflammation there. And then we have MSM GLS itself. So I often will recommend that Ligaflex, you pair Ligaflex with MSM, especially when you're looking at tears, ligament picture, because they work really well synergistically, and you're going to speed that repair phase up. And this, again, acutely. And in the RIBA Pad, that's a whole other, which Heather's going to get into in a bit later, and this is using the pulse electromagnetic therapy. And so that's a whole other thing that you're getting right into the tissues, right into the ligaments, right into the body, and really help to stimulate that. Again, Heather's going to go into more detail, so I will leave that for her. Okay, so this protocol really, really works well. And I was a pro track athlete and a fitness and bodybuilder. So when I started working with Biomed and realized that they have all these products, I'm like, where was this when I was competing? What is this? So all throughout my fitness career for the last 10 years, I've been very fortunate to be able to use these products and know firsthand they work. So I'm not just telling you because it's a protocol, I'm also sharing with you because I've used them and I've recommended them to practitioners. So again, as I stated before, tissues and ligaments, Ligaflex is a must, and this is something that you need to get in and be aggressive with this one. Even though we give you the Health Canada dosing of 2 capsules 4 times a day, I've gone up to like 6 times a day from that acute. And then if you find there's a tear, and of course there's going to be inflammation with the tear, that with Clarizyme works so well because Clarizyme is a proteolytic enzyme, so it's also going to be reducing inflammation and eating any kind of blood clots and fibrin that the body is creating. So again, be aggressive with these. Clarizyme, make sure that it's taken away from food, otherwise it becomes a really, really expensive digestive enzyme. So those work really well together, Clarizyme and Ligaflex. And so this is the one that you can give to your patients right away. If you want a bigger bang for your buck and really get things moving, add self-tonic. Again, remember, we want circulation in inflammation because the more blood that we can bring to that site, the faster the oxygen transport is to the site of injury, the faster and the more rapid the body's healing mechanism. So self-tonic lets that happen. And again, self-tonic will help pull out debris. So you're getting that metabolic waste being pulled out, and you're actually getting the healing happening without much obstruction. So it's important to consider that. C-Boost is always a good general one to include, any vitamin C, just to help speed up that wound healing, speed up, again, that, and get the immune system up while you're increasing that healing. Okay, so we're going to switch a little bit, and Heather is going to tell you more about the RIBA Pad and using that.
All right, so with the RIBA Pad, what I really wanted to do is just mention the fact that the RIBA Pad, in addition to being able to do testing, for RIBA or for organs or food sensitivity or supplement compatibility, there's a whole other side of it. And what it is a pulse electromagnetic field therapy device as well. Where it comes into play today for this workshop is the fact that it is certified by Health Canada as a medical device for pain therapy. And so what it does is it uses these electromagnetic pulses, and those pulses stimulate the ions on the cells, positive and negative charges, so that it actually can start to come back into regulation. And through this whole process, what happens is you're actually able to reduce pain. And reduce pain because you're actually healing wounds, tissue regenerating, and reducing inflammation. It really does help to get in there and actually reduce inflammation overall, which then helps reduce the pain. So with the RIBA Pad, then, you're able to set different treatments. For pain, there's one specific type of setting. There's a protocol that you can use with it, and you can do it for simply a 2 to 30-minute treatment, or you could run through a few different parts of a protocol and have it for 30 minutes, 60 minutes, an hour, depending. And you get results with clients and with patients very, very quickly, especially in acute injury situations, but then also with more chronic situations as well. And so with the RIBA Pad, pain therapy, inflammation, wound healing, and tissue regeneration is one of the areas that there's been a lot of research on. I know on PubMed, if you start looking up pulse electromagnetic field therapy, there's over 8,000 articles and studies and research papers on it. So it's a field of medicine that's starting to become more and more well-known and used, and it's a really simple one to do in clinic and in office as well. Okay, so then we're going to continue talking about solutions for reducing inflammation. Angela was talking about enzymes, and so I'm going to talk now about some natural anti-inflammatories, and this includes two specific products, curcumin boswellia and tocopherol. And so both of these products work differently. However, they are both used as natural anti-inflammatories and for antioxidants as well to help reduce acute and chronic inflammation within the body. Types of things that it can help for, again, of course, pain and inflammation, both acute and chronic, but also some specifics. Both of them work really well with joint and muscle inflammation and arthritis, tendinitis, musculoskeletal pain and inflammation. And then there's also some other, curcumin works really well with any sorts of inflammatory conditions, like inflammatory bowel conditions, lung and respiratory inflammation. And then tocopherol has a really nice aspect of working in the cardiovascular system and the neurological system, so brain and the nervous system. Tocopherol also, the tocotrienols within the tocopherol have some amazing studies that show healing white matter lesions in the brain after strokes and TIAs. And then also this same healing mechanism can also be used in concussions as well. So tocopherol has an extremely strong neuroprotective component to it. And as Angela has already mentioned, and is actually going to be going into more detail in a little bit about tocotrienols, which are part of the vitamin E family, and getting into the cell membranes, and in the cell membranes working as a very protective mechanism, not only for free radicals, but also strengthening the cell walls in general. And that's part of the mechanism of action on how it can heal and then be protective against stroke and TIAs as well by strengthening the cell walls. So these powerful inflammatories, both formulas with all the ingredients in both formulas, they help control the inflammatory response. They regulate the cell signaling pathways involved in inflammation. They help to prevent that cascade that leads to chronic inflammation, so it allows the body to get back into a healing state. And then the free radical damage, it protects against that. And with the tocotrienols and with the krill, they also promote phospholipids within the cell membranes to help repair those cell membranes faster. So there's a lot of mechanism of action on how these types of products work. For curcumin boswellia, it's 1 cap 3 times a day, and it includes turmeric and boswellia. And the big component with that is it is in a phytosome. And the phytosome, because whenever we're starting to talk about these things, we also need to talk about absorption and how to optimize absorption. And so the turmeric and the boswellia are both in phytosome technology, and that allows for great absorption of those specific ingredients. Tocopherol, interestingly enough, it's actually got a patented self-emulsifying absorption technology that goes with the tocotrienols, and then the krill oil is bound onto phospholipids, and so those two ingredients within the tocopherol actually both have enhanced absorption ability as well, and then gets delivered into the body where it actually needs to be delivered, which is another study that the tocotrienols have done, is where the end tissue, where they end up in the body. And so that's how these two work specifically in reducing and addressing inflammation. We've got a question that's popped up about chronic sinusitis. And so in addition to choosing, actually, even to back up, so when we're talking from a biological medicine perspective on chronic sinusitis, we almost always have to go back to the gut. And understanding that all the mucous membranes in the entire body are intrinsically connected, and so gut inflammation can show up in the sinuses as a chronic sinusitis. So it's really important to do a lot of gut work and gut healing to be able to, as part of kind of a root cause of chronic sinusitis, start to get that resolved. And then in addition to that, looking at an anti-inflammatory to be able to help get the healing process moving. And so something like curcumin, boswellia, or serrapeptase, or clearazyme would actually be quite ideal in that situation. In a chronic sinusitis, I would probably choose serrapeptase or clearazyme, which includes serrapeptase, because it is a mucolytic enzyme as well, and so it's going to help to start break down some of that inflammation in the mucus that's associated with it. And then, of course, chronic sinusitis can also be associated with biofilm, and so the serrapeptase will also help break down some of that biofilm. And then the last thing that I would be looking at is, while it's outside of this kind of topic we're talking about, we do have a product called Hydrastis nasal spray, and it actually is a natural anti-inflammatory. And it is sprayed right up into the sinuses, and then that helps to reduce that localized inflammation and start getting things healing. It also has some natural antimicrobial properties to it, because you can get bacteria or virus or fungal microorganisms also associated. So kind of in a long story, treating the gut, reducing inflammation through something like serrapeptase, and using something local like Hydrastis nasal spray to help with the symptoms. Okay. So then let's continue on. And in this workshop setting, there's some other tips aside from just products we wanted to talk about. And what I have to say is, if you've never tried golden milk before, or golden tea, it's also known as turmeric tea, you absolutely have to do it. You have to do it tonight, and if you don't have the ingredients, go to the grocery store. If you can't do that, then you make sure that you get them tomorrow, and you make this for yourself on the weekend. This turmeric tea, it's absolutely delicious. And it's really, really healthy, and it's very naturally anti-inflammatory. I think it's important to be able to have these things that we can do in our daily kitchen and what we're eating to be able to promote good health, and in this case, be able to reduce inflammation as well. So what you want to do is you want to take non-dairy milk, something like coconut or almond milk, and you would mix it with some coconut cream, some turmeric, freshly grated if you can get it, otherwise powdered, also with some freshly grated ginger, some cinnamon, and some black pepper, and sweeten it with a little bit of honey or maple syrup. If you don't want to use those, you could use stevia or monk fruit extract, and combine all the ingredients in a pot, bring it to a boil, reduce to a simmer, and let it cook or simmer for about 10 minutes, and then strain it, and you don't necessarily have to. I don't usually strain it, but to make it smooth, strain it, serve, and enjoy. And one of the things out of this, for the turmeric, again, for optimized absorption, you need it to be with a fat. So that's why the coconut cream or some other fat needs to be in there. And then the black pepper also enhances absorption as well. So as I said, if you haven't ever tried this before, you need to definitely try this. And if you have tried it before and you forgot about it, then you definitely need to this weekend bake it for yourself because you'll feel great when you do. I personally love having golden milk on a rainy day, especially in the evening. It's one of those things that's kind of very soothing and quite delicious. So, and if you're kind of craving, the flavors in there can be strong, and there's lots of kind of good fat in there, so it's very satisfying as well. Okay. Now this is making me want to go home tonight. I think after I say this, I'm going to make it for myself tonight. Okay, so now we've got some voices coming through from practitioners, which are your colleagues, about some experiences that they've had with some of the products that we've already discussed. So one of our functional medicine practitioners out here, Sammy O, who is highly, highly experienced, and she's got tons of credentials behind her, and her newest one that she's working on is a functional medicine credential. She really loves tocopherol. She asked me to share the story about herself and the fact that she has ADHD, and she finds that tocopherol is one of the best products that she's ever found for brain care. And what she's noticed is it helps improve concentration, both in adults and children. Also, the adults and children are not as exhausted from kind of the ADHD symptoms. And her brother also finds that using tocopherol makes him sleep better, and he says that he sleeps like a baby. So for Sammy specifically, what she had said was, tocopherol is like an anchor for my brain. My brain feels calmer, more rested, not exhausted as easily. I have never felt this from any other omega ever, only tocopherol. So she's a huge fan of this specific product, and specifically for brain care with patients and clients.
And in this next one is actually one of my favorite practitioners. She's an ND in Alberta. And so she uses she's a biological medicine practitioner, uses the heart rate variability. So this is her findings with tocopherol, and I can kind of second that because I found that with toco as well, being an athlete. So she stated that this athlete is a competitive professional athlete, and so when he was tested on the heart rate variability, so if you're familiar with using this, the higher your numbers, the more chronic, the more degenerative the conditions in the body. So his results were type 5. So as she said, it's quite concerning. It was almost career-ending, the injuries. So after 1 month of being on tocopherol, it brought his levels down by 1 point, and 1 point jump in a month is unheard of. I mean, that's huge. That's a rapid decrease and repairing and healing happening. And so he's continually taking the tocopherol, and over the last 3 years, she's reported that he's maintaining at a type 2, and type 2, type 1 is a fairly good place for us to be sitting at. So, and this patient says that this is the only thing that helps them and was able to save their career and actually keep them competing. So without tocopherol, they couldn't have imagined continuing their athletic career and endeavor, and the oxidative stress on the body, the tears and the injuries. So tocopherol really does have a beautiful mechanism of how it works. And as Heather stated before, you know, that phospholipid is crossing the blood-brain barrier, is getting right into the cell membrane. So that's something that it's important for you as practitioners to keep in mind and thinking again. Remember, we want you to think outside the box. We want you to think from a different vantage point, a different perspective. All right, so now we're going to switch back to more specific protocols. So osteoarthritis. So basic tab, tocopherol, and or Asta, curcumin, and clarizyme. When you're thinking of osteoarthritis, you really, really have to think about the milieu and the terrain. So it's not just thinking about the degeneration of the joints and the cartilage, the bone, which those who have osteoarthritis really experience that pain and that stiffness. And if they've sat too long, that stiffness really gets into play. Again, first and foremost, you definitely need to address the terrain, the milieu, so that acid-base balance, because when you're looking at acid-base balance, especially with the basic tab, you know, when you're taking it, you're you're allowing, one, we want to take it at an optimal point when the sodium-potassium pump opens. So ideally, you want to take it around 10 a.m. and the second dose at 4 p.m. because that's the time that the sodium-potassium pump is optimal. So when that opens and you take basic tab, you're flushing out that tissue acidosis. And now those minerals are getting into the tissues and they're actually cleaning out the acidity, they're cleaning out the debris. So it's important for this picture and just any degenerate conditions in the body that you address the acid-base balancing. For optimal, we always recommend that you do this for at least 3 months. So with basic tab, it's 2 tablets twice daily with warm water on an empty stomach. So a way to dose this is their first dose, I recommend that practitioners dose it when patients get them to dose it right after they wake up. So they're coming off of a fast. So you already have that empty stomach, warm water, take the first 3 tablets, and then 30 minutes later, then they can take other supplements. So it makes for easier compliancy. Okay? And then tocopherol, again, with that C-reactive protein picture, reducing inflammation, really getting the joints more lubricated as well. So toco and asta, this is one to include in this protocol. And so it's 2 capsules daily. You can either take 2 capsules at once or you can split it up 1 capsule twice daily. And as Heather stated before, curcumin boswellia is really important to include in this because you are still going to be addressing the inflammation from the arthritic picture, not just the bone, not just the pain and stiffness, but the actual inflammation surrounding it. So with curcumin, you're doing 1 capsule 3 times daily. And with Clarizyme, again, with that proteolytic systemic enzyme, it's important to get in there because that, again, is going to help break down, the fibrin picture. It's going to break down any of the plaque-like stiffness in the body. Again, 2 capsules, 2 to 3 times daily. I find with Clarizyme, especially when looking at osteoarthritis, if it's an early onset, like that patient's just coming to you, dose them 3 times daily because you can actually help halt that. So be aggressive with it so you can help to start reversing that damage. So don't be afraid to go aggressive with that. And osteoarthritis is unique because you really need to look at other pictures. Again, we talked about acid-base balancing, but they need to do a lifestyle haul. They need to change their lifestyle. If you have patients that are congestive, get them to limit their animal protein. It's really important because that's acidifying. Because as you're trying to alkaline them and they're still eating animal protein, it's you're negating the work that you're trying to do. So get them to reduce animal protein, increase more of their plant-based protein, reduce processed and refined white sugar. That includes rice, breads, sugars, pastas. Just limit that, really take most of it out if possible, and allow the body to calm down. And you'll notice a huge difference, especially with this particular picture.
All right. So we're going to talk about some systemic enzymes. Angela's already been preluding, of course, to the Clarizyme and the serrapeptase. And just to also mention about the Clarizyme, it's actually a combination of a number of systemic enzyme ingredients in addition to some other enzymes as well. And so Clarizyme does contain serrapeptase. So in some ways you can do some actually interchanging with the 2 of them. Serrapeptase has a very specific picture, so it's a proteolytic enzyme and it's also a mucolytic enzyme. And so it's breaking up mucus and breaking down mucus and breaking down protein. Clarizyme, of course, does those things as well, but it has a little bit of a broader spectrum because it's got more enzymes within it. It's got some chymotrypsin in it. It's got pancreatin and enzymes, a variety of them from the pancreas. And then I believe it's got some papain and some bromelain in there as well. So with systemic enzymes, and this is not to be mixed up or confused with digestive enzymes, the idea is you don't take them with food, but instead you're taking them on as an empty stomach, as Angela mentioned. And the idea with this then is your body is able to absorb them and then be able to work at breaking down protein or inflammation in other areas of the body, not just within the digestive tract. It helps to reduce acute and chronic inflammation and things like pain, and then other types of things, wound healing, post-operative healing, after dental surgery, swelling that can happen in the mouth. And then also it's working at kind of any inflammatory process within the entire body. And then very specifically because of the mucolytic component, you can't forget about any inflammation that's associated with all the mucous membranes in the body as well. Finally, and as another point to note, is it also helps break down, both of them work to break down biofilm. And so if you were on our Candida webinar last month, Angela spent quite a bit of time talking about biofilm and how different products can work in different ways with biofilm, and serrapeptase actually breaks the mucus up in the biofilm so that the body and other formulas and remedies you're using can get in and take care of all the critters within the biofilm that are making the biofilm. So systemic enzymes, as a mechanism of action, they help reduce capillary permeability, and that permeability, while it's important in the initial stages of acute inflammation for the healing process, when it becomes chronic, then you have this happening often. So this is helping to reduce that and help to reduce the swelling and the redness and the inflammation. It helps break down abnormal proteins. It allows decomposition of byproducts of the healing process to start being broken down faster, and it helps regulate the immune cells as they're migrating to the inflamed site to be able to do the job that they need to do. And that is definitely very important in chronic inflammation because you really want it to heal. You don't want to keep triggering and triggering and triggering. So Clearazyme then, 2 capsules 2 to 3 times a day, depending on the situation that you're working with, and serrapeptase is 1 capsule per day. Off-label, you could probably increase the dose. The one thing, though, with serrapeptase is that it is a very high, it's the highest dosage per capsule on the market. It has 120,000 IU or SU units per capsule. So it is very, very potent, and you don't actually need to take as much to be able to get the desired effects. The one thing just to note, and it will say this on the label, and it also does say it on the information that we have available, is you need to have caution with patients that are on blood thinners. Because it does clean up fibrin in the blood, and it helps to improve blood flow, which then, while it's not a blood thinner, can have some blood thinning type effects. So that's the one big precaution. The other big one to remember is if anybody has any active ulcers in the digestive system, not to use a systemic enzyme in those cases either, because the mucous membrane is usually not there as a protector. So, okay, so then there's a question here. Just see if we can. Yep. So a psoriatic, we just got, while we're here, if you ever saw kind of the backstage of what Angela and I are doing, we're sitting here, so you know, and we've got a phone because you have to talk into the phone rather than the speakerphone. So we're passing the phone back and forth, and we're monitoring the questions and the Q&As that are coming through as well. So sometimes if you ever hear a bit of a pause, sometimes it's reading these questions just to see if we can answer them in this moment or if we need to save them until later. So there is a question that came through about psoriatic arthritis, if it's a similar process to the osteo protocol, and absolutely, yes, it is. In addition to what is already mentioned within that protocol that Angela was talking about, Sanavis, which we're going to be talking about in just a very short moment, needs to be added into that protocol as well, kind of as an autoimmune component. So we're going to actually be talking about autoimmune in just a minute. Okay, so then we want to bring another practitioner voice into the webinar, and this is for a case of fibromyalgia with pain. And so this is a dark field microscopist who's also a medical herbalist, and she is a teacher at Pacific Rim College in here on the West Coast. And so she does dark field and really loves using Clearazyme in cases of fibrin. And so Maureen had said Clearazyme is amazing because it breaks all that fibrin down in the blood. She was sharing some blood pictures, And so within the initial visit, it was a fibromyalgia case with pain all over. It hurt whether this patient was moving or not moving, and the mobility was compromised. So the first two images of the dark field images, there's a lot of fibrin. It's a little bit hard to see, so you have to kind of look up close. Maybe what I'll do is enlarge one of these photos for you in the follow-up email. But when you see the image up close, there is all kinds of these little white strands, which is fibrin, within the blood. And so the fibrin is indicative of a very high degree of inflammation and liver congestion. Fibrinogen is also an acute phase of proteins in response to inflammation. As we were talking about in that chronic inflammatory process, fibrinogen is one of the biochemical markers for inflammation. And so this also means clearzyme and serpeptase and potentially and nattokinase all help to actually break this down. And so after this client, 6 weeks later, was taking the clearzyme plus some diet modification and some acid-base balance, it cleared all the fibrin up in all the blood pictures. The inflammation shifted from a 9 out of 10 to a 1 out of 10, which is significant, and no longer needing to be taking any NSAIDs for pain. The fibrin was significantly reduced. And so as Maureen said, through her extensive experience as a dark field microscopist, although her improvement also included pH balance and diet adjustments, I credit the systemic and fibrinolytic enzyme capacity of clearzyme for dissolving the fibrin. So for everybody who put their voice into our webinar tonight or our workshop tonight, we are so appreciative, and to be able to see kind of the experience that practitioners have been having with the products that, Angela and I love just so much. Okay, so now to continue just with the systemic enzymes, let's move on to nattokinase. And so nattokinase, it's different than serpeptase and clearzyme. And it's different because it's a fibrinolytic enzyme. So it's focusing on fibrin opposed to protein and mucus. So it's a fibrinolytic enzyme breaking down fibrin in the body. Fibrin is used as a natural part of the inflammatory process, the acute inflammatory process and healing process, laying down this fibrin net or network to be able to actually start to heal, to create a scar, to stop bleeding, to form a scab. And so it's got a very specific purpose to be able to start the acute injury healing. However, if that scarring or the fibrin is built up and it's not clearing out, then that's when it can start to cause problems. And so the fibrinolytic enzymes help to break down that fibrin within the body. So therefore, it helps to reduce inflammation. And then very specifically, fibrin is also part of the network for blood clots, so it helps to break that down to help prevent blood clots, which also means that you've got improved blood flow and blood circulation in the body. Angela's already talked about how important it is for healing to make sure that there's good blood flow going to this injury site, so nattokinase is also going to help to promote this. Nattokinase, as this type of enzyme, a fibrinolytic enzyme, breaks scars down. It also breaks biofilm down. And in concussions, I've had a practitioner saying that he always uses nattokinase in concussions because after a concussion, you get a fibrin network that's laid down. So nattokinase is really important to be able to start actually breaking that down so that you don't end up with a scar that's causing more symptoms or a longer healing period overall. And then the other thing, kind of when we talk about it a little bit more off-label, is that because it breaks fibrin down for fibrous kind of breasts or uterine fibroids or any conditions that are associated with fibrin or fibrous tissue, then nattokinase is also going to be very, very helpful. Okay, so now we've got another case or another presentation by a nurse and homeopath in Toronto. And she has used nattokinase with a number of different clients with fibrocystic breast tissue. And so she recommended it for 3 women with fibrocystic or dense breast tissue. And the women all were of different ages, in the mid-40s, 59 and 80. 1 month later, after taking the nattokinase for 1 month at 1 capsule a day, each woman reported significant reduction in lumps and cysts within their breast tissue. This observation was also confirmed by ultrasound, and these changes have continued for the last 6 months when they first started. So very significant improvement with using nattokinase, and and improving breast health overall. Okay, so then we are going to shift again, and now we're going to start talking about the acid-base balance component when we were talking about our different layers for the underlying root cause. So one of the things, again, is acid-base imbalance, or acid-base balance is what we want to achieve, and we want to do that through an alkalizer. Angela was talking already about basic TAB, and so the whole thing with an alkalizer is that excess acid that accumulates in the body that the body is not able to actually get rid of or detox overnight every day. Once, you know, that threshold has been reached and the body's no longer able to be super efficient to clear those excess hydrogen or acid molecules out of the body, you start to get inflammation in the tissues. And with an acid-base balance remedy, what you're able to do is help move this hydrogen ions or acidity out of the actual tissues in the terrain and the connective tissue, and then you're going to make the body less prone overall to inflammation and being reactive and allergic reactions and potential for chronic conditions. So as we continue down through the roots of the root, inflammation sits on top of kind of microbial terrain, which all sits on top of acid-base balance. So this is an area within a protocol that we want to be making sure with any patient with inflammation, which is the majority of us, according to Inflammaging, we need to always be addressing and thinking about acid-base balance. It allows us to decrease the acute inflammatory response and then also helps in reducing the inflammation in chronic cases. And so therefore all conditions that are associated with that are also going to improve. The one thing that's also kind of cool as a side effect for acid-base balance, because you've got sodium bicarbonate and potassium bicarbonate as your key ingredients in your alkalizer, that bicarbonate becomes raw material for improving hydrochloric acid production in the stomach, pancreatic enzymes, and bile secretions. So as I said, as a byproduct of working and clearing out the body from an acidic perspective, you're also improving digestion overall. I've heard through some of the best biological medicine doctors in the world that 80% of the patient base can benefit from acid-base balance. So everybody, some fine-tuning, and then once a year after can be super beneficial. The two other things, and I know Angela's already mentioned it, empty stomach, warm water, really important when you're taking an alkalizer because you don't want to interfere with digestion and you wanted to get it absorbed right away. And then there's the morning and the evening are the convenient times. If you can do it during the biological times, more at 10 a.m. and 4 p.m., then that is the most ideal situation. Okay, so next
we're going to switch to organic acids. So again, we are still talking about acid-base balance, but these shift a little bit different. So the organic acids are available in the body, so they actually are necessary to feed the cells and the mitochondria nutrient and food so that they work at their optimal. And organic acids, they also help to actually protect the cellular matrix, intra and extracellular. So we have three organic acids, pleoform, which is of formic acid. So formic acid is necessary for all allergic arthritic type picture. So if you have the osteoarthritic, osteoporosis, rheumatoid arthritis, pleoform is definitely an organic acid that you need to include in a protocol. And so this one really helps to maintain and keep inflammation down in the joints and also inflammations associated with allergies. The other clinical pro or indications for pleoform as a formic acid can be used with those patients that are more sensitive and that have high chemical toxicity. So high chemical toxic load, pleoform really helps to push that out, not just environmental toxins, so toxic load from like plastics and things like that. So form is a really good one to use, and that's 20 drops 2 to 3 times daily. For the frail patients, those older patients, you actually want to dose them 20 to 30 drops 3 times daily, because that would just really help to move all of that out of the tissues. And the cell matrix. And if you remember, I was saying earlier that the cell membrane is where, when there's a damage there, that's where you get that inflammaging. So really important to take care of the matrix. And then next we have Sanivis. Sanivis is actually one of my favorite products and remedies across all 300 products that Biomed carries. I have this just love for this remedy. So Sanivis is, again, another organic acid. It's lactic acid, so positive lactic acid. So when you look at metabolic waste and debris, they are actually a negative lactic acid, so they're a burden. Sanivis is a positive lactic acid, so it actually neutralizes the negative lactic acid and pushes it out of the cell matrix. So again, that's why Sanivis is used in not just regular inflammation, acid-base balancing, but autoimmune and cancer therapy, because cancer produces a lot of lactic acid. So Sanivis is a staple remedy to include in that protocol. So it comes in various forms, the sips, the tabs, and drops. So 2 tablets or 30 to 60 drops, which equates to half to 1 teaspoon. And so this is a remedy that you can be very generous with dosing, because they're not going to have an adverse reaction. If anything, they're going to see an increased energy. You're going to decrease that lactic acid, move it out of the cell matrix. There's a faster muscle repair and regeneration, and it helps with flushing out debris. So people that are working out, older patients as well, they're going to find that they have less aches and pains and sore muscle. That's the lactic acid and Sanivis moving that. So it will increase that metabolic waste excretion. And then next we have Citro. So Pleocitro is citric acid. So it's, again, another organic acid. And now we're looking at the Krebs cycle. So Citro really helps to increase that cellular respiration, the mitochondrial respiration, and the ATP production. So it's increasing that energy, and it's really allowing the Krebs cycle to be optimal. Often, Citro and Sanivis are paired together because they work really well. While Citro increases that cellular respiration, Sanivis is going to help decrease that lactic acid and really help to push it out. So now you're getting an increased cellular respiration of over 350% because you're optimizing the cell matrix. And again, Sanivis and Citro are dosed almost identical. So little clinical pearl with these two: if you have patients taking both Citro and Sanivis, dose Citro in the morning and then dose Sanivis in the evening. So that's just something to remember, because remember, you don't want an overactive cellular respiration mitochondria in the evening. So definitely dose Citro in the morning more, and then dose Sanivis in the evening more. All right, so now we're going to switch again. Sammy O. I really have high respect for Dr. Sammy O. She is just a really, really astute and a seasoned practitioner. So Sanivis, and so I know she loves the organic acids, because as a biological medicine practitioner and a functional medicine practitioner, it's important that you get really comfortable and you get really proficient with biological medicine, and specifically with those organic acids. So in this case, she sees the shift in autoimmune cases with Sanivis. And as I was stating before, Sanivis really works on autoimmune and cancer, and so any sort of that degenerative picture. So Sanivis really illustrates that. So I'm going to pass it to Heather, and she's going to go into more details with this case.
All right. So I was able, very fortunately, to actually meet with Sammy yesterday as she was sharing this. She wanted to share it in person with me. So when she was talking about Pleosanivis in autoimmune cases, what she had shared was that 80% of the cases that she sees are autoimmune type cases. And she said Pleosanivis is the backbone of my treatment, with it being 99% tolerated well. which she felt was actually really important for me to know, that in almost everybody they really well tolerate the product. There was one person who didn't tolerate it so well, but that's because the detox pathways needed to be opened up better. She said that her patients with autoimmune conditions can be triggered and flare into inflammation very easily, especially when they're tired or stressed or they're not eating so well. And so she actually has these patients keeping Pleosanavis with them at all times, and the moment they get triggered, they take it immediately to nip the inflammation trigger in the bud. And she said it almost works in that case to just tone things right down. So this Pleosanavis calms down the autoimmune flare-up like a fire extinguisher, and she said, and it never fails, which I think are very, very strong and powerful words for her clinical observation, considering she sees very complex cases. The other thing that she was talking about is one case of reduced kidney function with only 8% kidney function, and with a lot of pain and swelling in the legs. So she used Pleosanavis, and she said to me, I saw it with my own eyes, the swelling go down and continued to go down and then control that leg swelling, and she used Pleosanavis to do that. So again, some very interesting cases, and again, thank you for the practitioners with their voices in our workshop tonight.
Okay, next protocol, we're talking about gout. So gout, I'm actually going to share with you guys a personal protocol. My husband is a professional photographer, and so he's always sitting in the same position, holding the camera, taking shots, and he shoots fitness and bodybuilding competitions. So he's had some gout flare-up in the past, and in one of his seasons last year, he was shooting quite a number of shows, and one of the shows, it's an 8-hour long day, and you're just shooting and shooting. So he all of a sudden felt his hand and his wrist just swell up and just start aching, and he hadn't been eating very clean, so right away he knew it was the gout flaring up again. And as we know, gout is an inflammatory arthritis due to increased uric acid levels and uric acid crystal. And so when he came back and I was like, well, what did you do? I always get him to keep, crazy enough, basic tab on him. So while he didn't take it with warm water, but he said that taking basic tab in that moment gave him such relief that while it was still swelling, he was still able to move and finish shooting the show. So again, it's still working on that acid-base balance, the whole body, keeping that terrain more alkaline. So this protocol works really beautifully because now you get into the whole systemic picture, the deeper underlying root with the acid-base balancing, and polygonum. Polygonum is actually the staple remedy in gout. So polygonum is designed, its mechanism is actually helping to reduce that gout picture, the crystallization, and really help to move the uric acid out. And then Solidago is a kidney remedy. So when we're thinking about excretion and uric acid levels and picture, the kidney is really responsible for that. So Solidago really helps. It helps to detox the kidneys and helps to tonify the kidneys and help repair the kidneys. So Polygonum, Solidago, those two are imperative in a gout protocol. So form you add into it from more of an arthritic, not just the crystallization, but if you have a chronic arthritis picture with a gout flare-up, then again, if you remember I stated earlier with form, you want to add that formic acid to reduce the allergic picture that forms. So again, basic tab, the acid-base balancing, you're going to do with on an empty stomach, warm water preferably, doesn't always happen, but preferably, 2 tabs or 1 teaspoon of the powder, Polygonum, 25 drops in water 5 times a day. I find to make it more compliant, I will actually encourage practitioners to increase the Polygonum drops to 30 to 35 drops 3 times a day, and that's just for compliancy. Ideally, you do want 5 times, but bump it up so that your patient can be more compliant. Solidago 40 drops in 8 ounces of water 3 times a day. Again, I try to keep the pairings similar so they can take the remedies together. And they can be, both remedies can be put in water together. Again, compliancy. And then same thing, add the form drops to the water that they put polygonum, solidago, and then add the form to it. The only exception is the acid-base balancing remedies, the basic tab, alcala, and basic powder. And definitely get them to eat lots of celery, cherries, and cherry juice, because these help to actually flush out uric acid. So it's important to increase that. And celery is also an alkalizing vegetable, so really easy to do. All right, so next, stress, autonomic system and stress. So you're going to have flare-ups. The more stressed people are, the more inflammation in the body. It's this vicious cycle. So you really want to help support the body. Lifestyle modifications need to be in place, but when we think about long-term stress, cortisol levels increasing, that fight or flight, this all is this triggering this vicious cycle that happens. Again, and this over time will break down tissue and will compromise the immune system. So it's important to support the body. And so one of the key remedies that really helps with free radicals and really helping the body to repair, again, we're going back to the cell membrane. Remember, we need to repair the cell membrane. That's the picture that really changes. That's really important. So biotrienol is, Heather's talked about tocotrienols before. So biotrienol is the trienols that are part of the tocopherol picture. So again, this formula has the 4 strains of the trienols plus the D-alpha tocopherols. And so these are important. Again, that mechanism, the suprabio, it's that bioavailable higher absorption. Again, it's phospholipid binded. And if you remember phospholipids, that binding is fast soluble. It's going to allow it to get into the cell membrane. Another important thing to note about biotrienol is they actually insert themselves into the cell membrane, and they block free radicals from actually ravaging the cell membrane. So it's important to have biotrienols in your arsenal, in your protocols, and there are actually a more superior vitamin E, period. Lots of research are showing that if you look at tocopherols and tocotrienols, from a molecular structure, they're actually very similar. The difference is trienols are shorter tails, they're double-bonded, so they're actually able to cross into the matrix, whereas tocopherols they're longer, so the actual villi in the cell membrane will push them out because they're not absorbing. So trienols are a much better vitamin E source to use. Okay, 2 capsules, 2 times daily, and they're small capsules, so they're really easy to take. And so when we thinking about the autonomic system, stress, so these RIBA remedies are just a favorite of mine. These are part of the acute remedies, and these can be used situationally or acutely. Simvita, that's all about that hyper function, that overactive, the brain doesn't shut down, the body is just in constant fight or flight. So this really is important to have to calm that whole system down so that your protocols can work just that much better. So the dosing for that is 12 drops twice daily in water. They can go up, and if you have patients that are having an insomnia picture, do an extra 5 to 10 drops with that. Nervita, we're thinking all about nervous tension, pain, the myalgic, the neuralgic picture, tightness. This is a remedy to give that patient 12 drops twice daily. And Paravita, that hypofunction and that exhausted adrenal fatigue picture, this is that patient, 12 drops twice daily. All right, and we're going to shift and wrap this up with the emotional picture and the underlining of that.
All right, so we're down to the bottom of those root causes, and with the emotional picture and the emotional pain being, in a lot of cases, the deep, deep root. And this is where Angela and I, when we're working with our own personal clients and our own personal practices, often where we do a lot of focus. While we, of course, address all the other levels, in some cases symptomatically or kind of relief, we always are looking at the emotional side of things as well. And so emotional pain does impact health. Life-threatening experiences like abuse can influence the neuroendocrine system, the immune system, and the peripheral nervous system, and that all impacts the function and long-term health of different organs like the heart and the lungs. And then we also have research, and it continues to come out more and more about emotional pain can result in inflammation. And so there was a study done in 2016 from the Molecular Psychiatry Journal, that's where it was published, looking at childhood trauma and how specific traumas actually would have different biochemical inflammatory markers depending on the type of trauma that was creating symptoms in adulthood. And so what they found was that childhood trauma contributes to a pro-inflammatory state in adulthood. And then, as I said, specific inflammatory profiles depend on the specific type of traumas. So this is now starting to get even more detailed as far as looking at different types of trauma, not just trauma in general, from the emotional perspective, and then how it's affecting inflammation and disease and chronic conditions within the body. When you look at emotional pain, then you have that emotional trauma that is stored energetically within the body. It moves subconsciously. You have a repetitious effect, and then it starts to negatively influence the cells, the metabolism, and the autonomic nervous system. And so if you're thinking of this as our bottom layer, and then you've got this emotional trauma that has the autonomic nervous system and stress sitting just above it, then you can see how then you can start adding the next layer, because then the stress in the autonomic nervous system and the cortisol starts to create some acid-base imbalance component to it, because if you're not breathing properly, then that's also going to create an acidic situation in the body. And then you have the terrain that's now out of balance because acid base is out of balance, and so you start to get the microbial picture starting to go out of balance. And biofilm starts to have a heyday, and then inflammation sits on top of that, and then you have the symptoms and pain that's sitting on top of that. So you really do want to get down into the autonomic nervous system, stress, and emotional realm to really be able to have a long-term impact in symptoms and reducing pain for people. If you want to look more into this and look at studies, the two areas of psychoneuroimmunology and psychoneuroendocrinology, and there's also a psychoneuroendo-oncology. Like, there's a lot of research in the last 15 years by Dr. Candace Pert, who started it all. And so just kind of as far as a solution from us, we have RIBA Pad as the psychosomatic energetic remedies that are working at clearing old unresolved emotional issues. And so there is a testing process that goes through, so you determine where there's an energy block in the body, and then you determine what emotional issue is active, and then there's combination remedies that you're able to use to start clearing that out and working at that deeper underlying root to be able to ultimately help with the physical symptoms that's going on.
And then to look at emotional pain, the chart, as Heather was talking about RIBA meds, so each of the different injuries or inflammation or pain also has emotions attached to it. So stiffness, discomfort, distress, agony, all of these are tied into different pain and inflammation. Arthritis, as we see, is a feeling of unloved, criticism, resentment. Bone breaks and fracture, it's that feeling, emotional feeling is rebelling against authority. Bursitis, repressed anger. Inflammation, it's all about fear, seeing red, inflamed thinking, and judgment too in an aspect. Joint pain, this represents change in direction in life and the ease of these movements and people not wanting to change. Loss of balance, so this is an emotional picture of not being centered or scattered thinking. Slipped disc, if you have patients that this always happens to, it's also a deeper underlying emotion of indecisiveness, feeling totally unsupported by life, and then therefore that's that physical manifestation in the body. Sprains, so not wanting to move in a certain direction in life, anger and or resistance. Again, they're fighting against life and against themselves. Stiffness, it's all about rigidity and that stiff thinking all around the body and stiff thinking in life. And finally, weakness is that need to feel, it's a need for mental rest and really just to unwind and to reduce that mental tax that the body is experiencing. All right, So now we're going to wrap this up. We're almost done, we promise. So this, if you take anything away from this, you need to have this on hand. This is your injury medicine chest. So this should be at home. So breaking it down, pain and inflammation, have curcumin boswellia. Any kind of sprain, strain, Ligaflex, as well as Clarizyme. Serrapeptase you should always have on hand, not just for inflammation, but also for allergies. So always have that one on hand. Bruising, contusion, you got Clarizyme, Serrapeptase, Pleosanivis ointment to help the body heal faster, again, increasing that circulation, putting blood flow there. South tonic, and South tonic has multiple uses, so increased oxygen transport, helping to break down any kind of plaque buildup, microcirculation. Wounds to help wound and speed up healing and immunity, C-Boost and Right C. And C-Boost, just as a side note, it also helps to replenish electrolytes in the body too, and you'll find a higher blood plasma. The C stays in it much longer. It's 2 Cs. But that's another conversation for another day. Also helps with healing and collagen production. And again, at the end of the day, you do want to heal that cell membrane and heal it quickly, biotrienol. And this one works for everybody. So one to have on hand.
All right, and we're going to leave you with this slide that's about the lifestyle modification as far as an anti-inflammatory diet. It's actually really easy to be able to find information about anti-inflammatory diets. There's a lot of books that are out there, and there's just a couple of things to remember. When you're working with an anti-inflammatory diet, you do want it to be more alkaline foods, because then that helps reduce the acid-forming component, and it actually helps to exclude a lot of the inflammatory foods. And then the other thing when you're dealing with an anti-inflammatory diet, as Angela says, remember it's an 80-20 rule. Try to be choosing foods that are 80% of the time, and don't feel so bad about yourself if you 20% of the time are including foods that shouldn't be kind of on a daily diet. All about eating real whole foods and less about processed, refined junk foods. I know we're kind of preaching to the choir here, but, you know, it's good to also remember we've got some really nice charts here for you. It's an anti-inflammatory diet that's also mixed with Dr. Rao and Dr. Wortman's restorative and regenerative diet. So it's serving quite a few purposes. The one thing to really remember about foods to remove, Angela's already talked about this, making sure that there's not an excess of animal protein in the diet, making sure to remove those nightshade vegetables, which do include things like potatoes and tomatoes and eggplant, and take out the foods that are also going to be allergen forming. Take out conventional dairy because it can be very congestive and creating inflammation and stressing and burden on the immune system. And then finally, take out those refined vegetable oils and canola oil. Instead, make sure lots of healthy fats, lots of healthy fish, smaller fish are better, avocado, olive oil, coconut oils, anything that's rich in omega-3s, turmeric tea, turmeric golden milk. As you know, it's awfully delicious. And then foods that are rich in antioxidants like blueberries and other berries are some of the key things to remember. The other thing you can add in, which really has a big benefit in the body, is bone broth. It's got lots of minerals in there, and it's also got collagen, so it's a very healing food. All right. And last but not least, let's just reinforce those best remedies to put out the inflammation in the body. As Angela just mentioned, we've got serrapeptase or Clarizyme as these proteolytic enzymes breaking down inflammation. We've got curcumin boswellia as an anti-inflammatory, again working at reducing inflammation and pain in the body. The tocopherol or astacryl have huge anti-inflammatory, antioxidant, and cell membrane protection capacity. The RIBA Pad, using pulse electromagnetic field therapy to reduce pain and promote tissue regeneration.
And as the whole realm of repair and regeneration, make sure your patients are hydrated. Even that basic function of increasing the fluid intake and dehydration causes a lot of essential, issues in the body. So get that basic down, increase their fluid. Heather and I, we always recommend to practitioners, especially when they're doing the RIBA meds, that it's better for their patients to put all their remedies in a liter or so of water and then drink that throughout the day. So at least you're assuring that they're getting some levels of hydration. And at the fundamentals, get sleep, increase sleep, because that allows the body to actually rest and recoup. And when the body's resting, that's when the repair is happening. So the muscles heal faster, the body regenerates, and so they can attack and handle the day again. So at the end of the day, alkalize the body, bring down inflammation, look at the key markers, look at the emotional picture and the underlining, and overall just make smart lifestyle choices and decisions so that your patients can live a longer, pain-free life, and they can enjoy their life and their day-to-day work and movement much easier.
Great. So thank you, everyone, for joining us tonight.
And we hope that you were able to get a lot out of this. We're really passionate about getting information out to you practitioners and doing research and really relying on our practitioners like yourselves and colleagues to really help to broaden our scope and our knowledge. And we really appreciate and enjoy you guys being on this call with us and attending this. And we're so excited and we're glad to be able to share our knowledge with you. And hopefully you can take this to your patients and start applying it tomorrow.
And then finally, not only do you want to try turmeric milk or turmeric tea, but you also want to learn more about the RIBA Pad and pulse electromagnetic field therapy. And Angela and myself, will be super excited to be able to share the information and the benefits of the RIBA Pad by On Demand. Okay, thanks everyone. Have a great rest of your evening. Take care. Bye-bye.